I think a couple of challenges that I see, at least from the medical side, is awareness. That is really a big challenge, not only with our firefighters, but also with our healthcare providers. And why I say awareness is cancer is a thing that most people don't think about, especially when you come into the service, but it is very real. We all know friends and family that have personally been affected by occupational cancer. And so it's really hard to treat something that we don't even acknowledge exists or don't even know exists. And so I think one of the big challenges is letting firefighters know and educating our guys and gals that this is real. It used to be heart attacks and heart disease was the number one killer of firefighters. Now we know the occupational cancer is the number one killer of our guys and gals, our friends, and that's a big deal. It's really important. And so training our firefighters from cadets all the way up through our staff is going to be huge to help fix this and to help prevent this occupational cancer and to survive it. But not only with firefighters, I think we need to educate our healthcare community as well. Many doctors, nurse practitioners, folks on the healthcare side don't know that this is a thing. We understand that cancer exists, but we don't really realize the occupational risk factors that our firefighters face. And so we are working on a number of ways to train those healthcare providers and increase that awareness because there is that need there. We'll talk about that in a bit, but I think that's really, it's going to be a really important thing. Another important thing is you can train and teach and educate your firefighters. You can train your and teach your healthcare providers. But it's also really important to educate our insurance as well and coverage because if we can order something, say a diagnostic test, it may not be covered. But until we can show, hey, there's this data, there's a need, we need these screenings at an earlier age, then we can get these covered, get this prevention covered. So that way we can detect early, treat early, survive this early instead of all those personal and financial costs later. I think those are a couple of really big things to talk about. And then finally, if we do get diagnosed, how do we get this covered under presumptive law? Because we have a number of our firefighters that have had cancers that are covered under presumptive law that still are not getting covered despite that cancer being known as an occupational cancer on the law. So I think those are three big hurdles that not us as SAFG, but the entire nation with firefighter cancer awareness is facing.
Hoyt Allen, engineer, Fire Station 41. I've been with the Cancer Committee for roughly 10 years or so now. I think around 2015 is when we really kind of put our Cancer Committee together. And the reason why we started it is because of the death of one of my cadet classmates, which is his name was Lieutenant Woody Woodcock. Um, he had a horrible cancer diagnosis of leukemia, a rare form of leukemia. And so that's really kind of when we kind of realized in the department that we had an issue. We were tracking stations and, where people were, stationed at, and then trying to figure out like what was the reason for these individuals coming down with cancer. And we kind of pinpointed it to one of our fire stations. It was an older fire station that a lot of these individuals were stationed at, over a period of time. And so that's when we kind of realized that, you know what, maybe we do have an issue. And then when Woody became diagnosed with cancer, that really kind of put the spotlight on it, I guess, so to speak. And so that's when we developed a cancer committee and started coming up with, ideas on ways to combat this horrible, disease that we get. But I would think some of the challenges and hurdles that we've seen is just buy-in from really the older guys. We do a good job of reaching out to the young, guys and girls that are in the department. We get them when they're in the cadet class and we talk to them. And that's something that we haven't been doing in the past until the last couple of years. So the young people are really catching on and buying into what we're doing, but trying to get the older firefighters to really kind of buy in and kind of understand the process that, hey, we're all susceptible to this. And these are the things that we have to do to prevent, us obtaining a cancer diagnosis and stuff. So I think that's probably one of the big hurdles that we've had.
I didn't realize cancer was such an issue way back when we started realizing that cancer is now the leading cause, like Doc mentioned. I wanted to get self-informed for myself, and then how can I help others? And so that's kind of how I joined in. Put out all this information. We put out podcasts, we put out messages, stand downs, all the stuff that we do, all the information goes out to the field, but you can only do so much. And so I think one of the issues is, another metaphor, you can lead a horse to water, but you can't make it drink, right? So we put all this great information, all this stuff out, but there's still some hesitancy just by individuals that, don't really care about, they don't want to go to doctors. They don't want to find out that they have X, Y, and Z. And so ignorance is bliss. And so they don't want to, so there's always that issue as well.
So starting off with our firefighters, one of the really big things that we do, and this is our third year now coming up in 2025, is we do a health and wellness and cancer prevention fair for the department. Not only do we do it for our guys and gals, all 1,800 of them, but we invite their families in, we invite the retirees in, and then we invite our community members in as well, the community healthcare partners. And so it started off small. So initially we just had skin cancer screening, pre-esophageal cancer screening, and that was it. But that brought out 800 firefighters, and we found pre-esophageal cancers. We found skin cancers. Some of our friends, we found cancers in that they were able to successfully get removed and treated, which is great. But we've expanded that this year. And now, in addition to those screenings, we also have UDS, we have ultrasound coming out, we have blood bank to help out with PFAS, reducing those in the system. We have our cancer partners coming out. We have our community healthcare partners coming out, including our GI doctors, our cardiologists, our oncologists. And so we're bringing all these folks together to really help educate our firefighters and their families. We held a really big talk for our cadets about the whys, and we had a panel, and we shared our stories of why we do this, why it's important. We talked about risk factors, we talked about prevention, we talked about Cancer Support Network, we talked about the white papers, the 11 golden rules are going to expand.
Our training, CE Target Solutions, we have a 2-hour TCFP course that's mandated that all firefighters go through.
Well, like Dan said, we do the stand down. We get to go around, so our chief allows us to, take basically a whole week. And like Dan and Doc said, we go to every station, we talk to every person on every shift, and we talking about what we're doing and why we're doing it, and what are we, what's the reason? What is the reason that we're doing all this, cancer fair stuff and cancer testing and all these studies and things like that? Do we need to switch out? Yes, we need to switch out gear. Yes, we need to do decon. Yes, we have to, and he's like, oh, well, no, we need to do that. You know what I mean? That's what our process is for. We have a quartermaster program where, we came from when we were doing nothing except washing your gear on the back ramp and then hanging it up to, now we've developed into a quartermaster program where we have a warehouse where we have our gear, it's washed and it's cleaned and it's bagged for us, so there's no excuse why you're not changing out your gear. So
the San Antonio Fire Department made a commitment to the Cancer Initiative in 2015 by directing crews to remove contaminants from themselves and their gear after every fire. In 2018, the fire department purchased a second set of gear for every firefighter to use while their original set of gear was being cleaned after a fire. This quartermaster was assigned to pull clean second sets of bunker gear for firefighters involved in structure fires. Upon arrival, they pull a staffing report utilizing business intelligence software that has the names of the employees at the incident, their identification number, coat size, pant size, and hood size. This list enables the quartermaster to begin gathering gear for the personnel on the scene. Gear swap involves the exchange of coats, pants, hoods, and helmet ear flaps. Hood and ear flap exchange is a recent addition to our process. We have found that this will ensure our hood inventory will wear evenly, our firefighters are using clean ear flaps, we will need to purchase less inventory, and we will have increased frequency of hood inspections to ensure the integrity of the hood so they are safe for field use. Each vehicle also carries a box that contains PPE cleaning supplies, so firefighters can clean the gear and equipment they don't turn in before taking it back on their apparatus. To meet the new requirements of NFPA 1851 and manufacturer standards were created and distributed to the field. Once the quartermaster has finished swapping gear, they return to the cleaning and storage facility with the bagged soil gear and place it in the dirty gear staging area to be cleaned and then advanced inspected. Once the cleaning and inspection is done, the quartermaster quality assurance officer inspects the gear, verifies any repairs that were needed were actually made to the gear, and ensures the contents and labeling for the bags is accurate. Once the quality assurance officer completes his inspection, The bags are then returned and stored in the quartermaster's inventory, which holds around 1,200 clean second sets of gear, and a loaner pool that contains 300 individual pieces of gear separated by size and type. If a firefighter was put in loaner gear, their custom gear will be returned to them by request. Safety is our #1 concern for our firefighters and their families.